Welcome everyone. I am Ibon Eguiluz from the Hospital Regional Universitario de Málaga and IBIMA Plataforma Bionan Institute in Malaga, southern Spain. And I'm gonna present our recently published article in Allergy journal, which is entitled Investigation of the Diagnostic Accuracy of Basophil Activation Test for Allergic Phenotypes of Rhinitis. In this study, we recruited patients with different phenotypes of rhinitis and healthy controls. For this study, the allergic status was defined as the positivity of the nasal allergen challenge, and we evaluated the atopic status by performing the skin prick test. In this study, we considered 4 different allergens: howdah's mite, alternaria, grass, and olive tree pollens. Allergic rhinitis patients were skin prick test positive, local allergic rhinitis patients were skin prick test negative, and dual allergic rhinitis patients had a combination of allergies with a positive and negative skin prick test. Non-allergic rhinitis patients, of course, tested negative to the nasal allergen challenge. In these populations, we performed the basophil activation test with the 4 allergens of interest, and we used CD63 as an activation marker. The first thing that we did is to identify cutoffs for the proportion of CD63 positive cells of the basophil activation test to differentiate between allergic and non-allergic individuals, in this case not taking in consideration the results of the skin prick test. So by the ROC curve analysis, we identified the cutoff points with good sensitivity and specificity for the 4 allergens. Using these cutoffs, subsequently, we investigated the sensitivity and the specificity for the basophil activation test for the different allergic phenotypes of rhinitis. For skin prick test positive allergies, this means allergic rhinitis and the systemic component of dual allergic rhinitis, the sensitivity of the BAT ranged 79 to 100%. For skin prick test negative allergies, this means local allergic rhinitis and the local component of dual allergic rhinitis, the sensitivity of the BAT was between 25 and 75%. And finally, for non-allergic individuals, this means healthy controls and non-allergic rhinitis patients, very few BAT were positive, in all cases below 10%. So, specificity of the test for the identification of allergy was also very good. Finally, we also identified predictors of basophil activation test positivity. For patients with local allergic rhinitis, severe rhinitis, according to the area classification, saw a positive correlation with the positivity of the basophil activation test, whereas for all allergic individuals, there was a significant association between BAT positivity and the occurrence of conjunctivitis. So, in conclusion, the basophil activation test is an alternative to the nasal allergen challenge for the investigation of the clinical relevance of skin prick test positivity. The basophil activation test can also decrease the number of nasal allergen challenge needed for the diagnosis of local allergic rhinitis and dual allergic rhinitis, but if the BAT is negative, a nasal allergen challenge is still required to rule in or rule out the allergic etiology in these patients. And severe rhinitis and conjunctivitis are predictors of basophil activation test positivity in local allergic rhinitis subjects and allergic patients, respectively. Thank you very much for your attention.